Hello, my name is Dr. Stanley Lang. Welcome to this video, and the topic is how do you know when your prediabetes state or your metabolic syndrome state is reversed? Now, a lot of people are on this continuum. Unfortunately, most of them are going the other way, but if you happen to be one of the faithful folks who are trying to reverse your prediabetes or your metabolic syndrome, how do you know when you've arrived? Is it when your weight is normal? Is it when something else that you can measure externally is normal, or is it something that you have to do on the inside? And the most reliable way to do this is with blood work. And so the simple way to do it, what we might call the poor man's way, is what is called the triglyceride HDL ratio. This is part of what's called the lipid profile or the cholesterol profile. And one of the hallmarks of insulin resistance, which is what's going on in prediabetes, is that the ratio of the triglycerides to the HDL becomes very distorted. It gets higher and higher and higher, and conversely, you know when you're making progress when you change it back to a very low ratio. So I saw two patients in the last week that reflect this process of reversal. The first patient just had very bad prediabetes. He wasn't diabetic yet. But when I saw him, his triglyceride HDL ratio was 10. Now, that means that the triglycerides are really high and the HDL is low, lower than normal. And HDL, or so-called good cholesterol, gets suppressed when the body is in insulin resistance. So the higher the insulin goes up, the more it pushes the good cholesterol down. And so that's what causes this ratio to widen. So when the ratio shrinks, we know we're making progress. As I said, in this case, this person's pre-treatment ratio was 10, and in the last 14 months, he has basically been following our standard low glycemic diet. He's not on a ketogenic diet, just doing the low glycemic diet, and he has dropped his ratio down to 1. So he went from a ratio of 10 to 1, which means that his level of his triglycerides and his HDL in his bloodstream are the same. And that's a profound reversal of insulin resistance, which most people don't achieve, but this person was able to achieve it without doing any exercise because he's got some physical limitations. So he was very carefully, just very carefully eating. Now, during this time, he lost 67 pounds, which is not too bad over 14 months, but importantly, he's still taking it off. The second person is somebody that was actually diabetic, and his A1, he wasn't that far down the path. His A1C was 6.9, which puts him above the usual cutoff for diabetes is 6.5. And after 2 years now of making changes gradually, his A1C has dropped all the way down to 4.4. He's lost about 129 pounds, and he's continued to make progress. So in both of these cases, I think it can be reliably said that the insulin resistance is reversed. Now, does that mean that these guys can go out and eat anything they want to without making things worse again? The answer would be a very strong no, because essentially once you've broken the chemistry and created this condition called insulin resistance, there's always going to be a tendency to kind of drift back into that. Imagine a river that used to have a certain channel, and then something happened and blocked that channel, and it creates a completely different channel. And we see this in some big rivers, and you see the residual of where the old channel used to be, but now there's a new channel. And the longer the river is in that new channel, the more likely it becomes the permanent channel. And that's what happens in the chemistry of insulin resistance. The body gets diverted to a completely different pathway, and it becomes more and more and more entrenched. Now, the longer it's entrenched, it's much harder to put it back into the original channel, but you can do it. It's kind of like putting up a dam and redirecting the flow of that river to the old channel. That's what you're trying to do. But if you successfully do that, there's always a tendency to go back to the new channel, the broken channel. And that's what's always there after you have reversed your insulin resistance. The tendency to go back to that broken channel is always there. You're never going to get rid of that predisposition. So you can eat a few high glycemic foods here and there without going back into that channel, but if it becomes a habit, you're going to be right back where you started. On the other side though, if you redirect back to the old channel, it's easy to keep it there just by eating low glycemic foods. And that happens to be the healthy way to eat anyway. It's consistent with all the health benefits that you want from eating if you want health. And so I strongly encourage that you take advantage of the simple things of low glycemic eating. If you have a question about what that looks like, at some point there'll be a link below this video. It's not going to be there right away since I'm just making the video. There'll be a link to a free book that you can, a free report that you can get that's called Why Am I Still Fat? And it'll help you to learn how to eat low glycemic in a way that works 100% of the time, not 99, 100% of the time if you follow it. So I hope these two stories of two average Joes, if you saw them on the street, you wouldn't say, no, that's an outstanding performer. You'd say, this is an average Joe. And both of them have made these profound changes. One of them couldn't exercise, still can't, but he's getting so that he can move a little bit more since he's lost his 67 pounds. So I encourage you to take advantage of your opportunities while you've got them, because the window is not always open. I wish you well, God bless, and have a great day.